Today is Wednesday, August 11th. In prior videos, I had mentioned that I would do videos once a week. But I think the numbers have changed. Some of the things we're doing in the hospital have changed, and it's worth coming back to you a little sooner. So on Friday, 5 days ago, I reported that we had 173 patients that had COVID here at the UF Health Gainesville campus. Well, today we're at 214. And we have seen that rise. Over the last couple of days, it's been, I would call it stable, but 2 days of stability, I don't think we can call it a trend or we can relax. So the numbers keep going up. Certainly no surprise to anybody who works inside of the hospital. We have 44 patients in the ICU. And for the last 3 weeks or so, 3.5 weeks in fact, we've had anywhere between 3 and 4 patients on the pediatric floors up to a high of 12. So things are still evolving and changing. The landscape around us is getting, I would call it treacherous. And maybe that's an overstatement, but at the Lake City Medical Center, which is only 50 miles away, today, this morning, they had 104 COVID patients. That hospital is only licensed for 99 beds. Now, certainly, they're doing what they have to do, and they certainly have more patients than the 104 because they have non-COVID patients. At Putnam Community Medical Center, which is also licensed for 99 beds, they have 63 COVID patients. Communities around us are struggling, and so it will have an impact on us. And it already has. Most of you know that the end of last week, we suspended and rescheduled elective procedures where an overnight stay would be required. So that's the next trigger to try to free up some beds. Today, we got some good news. Today, the VA hospital next door received approval from the state and the federal government to be able to offload patients from us. And from North Florida, not just us. So they will have to slowly accommodate. I don't think it's an overnight big solution, but it's one more little piece that can help alleviate the volume. The teams that work with ECMO, for example, have what seems like a limitless list of hospitals calling to see if we can take their ECMO patients, maybe some as a bridge to transplant, others as curative based on their COVID. We continue to be there for as many organizations as we can. But around us, things are really complicated. In the city of Jacksonville, all the hospitals are struggling with COVID patients. Students begin to arrive at UF this week. For those of you that have elementary or high school students in the area, you know that that's about to get back into flow. We're really at a point now in our communities that we have to get back to the things that we know work. We have to consider outdoor versus indoor when we can. We have to be mindful of some social distancing. We have to be more aware of the status of vaccination of people that we're with. Inside our hospitals, we're back to masking. Back in the community, you should be thinking about masking. You should find the appropriate times for masks to be on. I wear mine when I'm outside going into places. Certainly as I'm walking outside from my car, as long as I'm not around a lot of people, I take off the mask. That's my breather. But masks are back. Knowing who you're with should be important to you, meaning their vaccination status. Consider outdoor versus indoor. I know it's hot. I know it's rainy. Consider outdoor versus indoor when you can. I looked this morning at the models that the University of Florida's Emerging Pathogens Institute publishes. And the model seems to indicate that sometime towards the end of August is when we'll peak in the state of Florida. I haven't seen a model that specifies Alachua County. But quite honestly, I don't believe that would be all that hopeful. Because as a referral center, we're getting patients from everywhere. Today, for example, just under 50% of our patients are from Alachua County. So this is bigger than our county, but we have a big role we can play. inside the hospital in our community, I implore you to be ambassadors of the message of vaccination. Let's get people vaccinated. Let's press the agenda forward. Inside our hospital facilities, you know that next week, if you're not vaccinated, you have to wear an N95 mask. So we're going to keep pressing the vaccination message. We know it works. We know it dampens the impact. It's important. Thank you for all you do. The hospital remains full. As we add more COVID patients, we naturally have to decant others. The work doesn't get less on you. I appreciate it. All of management thinks about you and appreciates everything you do.